number 10, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Will he act to prevent closure of health services in Taihape?
The Honourable Peter Dunn.
Mr Speaker, on behalf of the Minister of Health, I reply he is keeping in close touch with the Wanganui DHB as they work to get the best possible outcomes for Taihape in the light of the decision of the trustees of the Taihape Health Trust to place the facility into liquidation. As a result of those efforts, the DHB has ensured the continuation of general practice, primary maternity, day services for older people, home-based support services, radiology, specialist outpatient services, palliative care, the mobile bus surgical service and more for the people of Taihape.
The Honourable Ruth Dyson.
Will he apologise to Donna Wood, the clinical coordinator of Taihape Health, who says in her letter to him of 23rd of November that his statement that Taihape will retain all its services is not true, and that Taihape will in fact lose its 24-hour access to prime trained registered nurses, it will lose its medical beds, it will lose its inpatient palliative care, it will lose its respite care and daycare services, its maternity services, its Meals on Wheels and its mortuary service. Will he now apologise to Donna and the people of Taihape?
Mr Speaker,
Peter Dunn.
Mr Speaker, I think it's important to put in context what the Taihape facility actually is. It is not a public hospital, it is a rest home, and despite significant contributions made by the DHB, including writing off some $450,000 of back rent and other support in the order of $1 million, the facility is simply not sustainable. And as I said in the primary answer, a range of services in Taihape are going to be retained and they will be to the benefit of the people of that particular town.
The Honourable Ruth Dyson.
Will he step in to ensure that aged care, post-operative and medical beds, palliative care and respite care services will not be lost to the Taihape community, as John Key, the Prime Minister, promised them recently?
The Honourable Peter Dunn.
Mr Speaker, the Minister has made it clear to the DHB that he expects the needs of the elderly population of the Taihape area to continue to be met, and I'm sure the Minister will keep the DHB to their obligations in that regard.
Supplementary.
The Honourable Ruth Dyson.
Does he have any concern at all for the residents of Ruanui Hospital, particularly one who turns 94 this Saturday and who is getting an eviction order from the hospital as her birthday present? A situation described by the current Member of Parliament, Simon Power, as unsettling, but clearly more than unsettling for the 2,900 people who have signed the petition asking that these services be retained.
The Honourable Peter Dunn.
Mr Speaker, this is always going to be a very stressful and testing time for people involved in that situation. That's fully understood. But the fact of the matter is that the trustees have decided to put the facility into liquidation because despite the fact that there's been a substantial cash injection into it, there's still a $450,000 debt arising from back rent, and they have made the call that this particular facility is not sustainable. As the Minister has pointed out, he is seeking assurances from the Wanganui District Health Board that a range of services will continue to be provided and that the people will not be adversely affected.
Point of order.
Point of order, the Honourable Ruth Dyson.
I seek leave to table the letter of 27th of November I referred to in a previous question, the letter from Donna Wood to Tony Ryle, which points out his statements, just repeated by the Acting Minister, are entirely wrong.
Leave is sought to table that document. Is there any objection? There is no objection. Question number 11, Amy Adams.
Thank you, Mr Speaker. My question is